You know that nagging, aching pain right at the front of your knee? People call it runner's knee, but you definitely don't have to be a runner to get it. Millions of people deal with it. But what if focusing on the knee itself is the very reason the pain just won't go away? We're about to dig into that. So yeah, that's the big question, isn't it? What if your knee pain isn't actually a knee problem at all? I know, it sounds totally backward, but the latest research points to a much bigger picture, and honestly, that's where the key to real, lasting relief is hiding. All right, check this out. 22.7%. That's a pretty specific number. Well, that's the chunk of the general population, not just athletes, everybody, affected by what's officially called Patellofemoral Pain Syndrome. This is not some rare, obscure injury. It's incredibly common, and it's sidelining millions of people. So if this is you, trust me, you are far from alone. Okay, so we've established it's common, but the real issue here isn't just how many people get it, it's how long it sticks around. Get this, 15 years. That statistic is just wild. It shows that for 1 out of every 4 people, this isn't some little thing that goes away in a few weeks. Nope, it's chronic, it's persistent, and it's a clear sign that whatever we've been doing to treat it just isn't cutting it. To really get why it sticks around for so long, we need to pop the hood and look at what's actually happening inside the joint. Let's talk about the mechanics of the pain. So at its very core, PFSS is really just a stress problem. Your kneecap, the patella, is designed to glide really smoothly in this little groove at the end of your thigh bone, the femur. When the stress on that joint gets too high, the whole system kind of breaks down, and that's when you start feeling the pain. You can really picture the difference here. On one hand, you've got a healthy knee, where the kneecap is tracking perfectly, smooth as butter. But on the other hand, in a knee with PFPS, that kneecap is getting pulled off course. It starts to grind and tilt, creating all this painful, unbalanced pressure. So the million-dollar question is, what's doing the pulling? And that question leads us directly to the real culprits. Because as we're about to see, the evidence is pretty overwhelming that the problem rarely actually starts in the knee itself. The big idea you need to wrap your head around is something called the kinetic chain. Just think of your body as, well, a chain. Every part is connected. If one link is weak or unstable, let's say your hips or your feet, then the other links have to work overtime to compensate. And guess which link often gets stuck with the bill? Yep, the knee. And the research totally backs this up. It points to a few usual suspects. Yeah, sure, quad weakness is on the list, but look at what else is here. Hip mechanics, what's going on with your feet, and even psychological stuff like being afraid to move, which, can totally change how you walk and just make everything worse. It's a really complex puzzle. So let's investigate suspect number 1, your hips. When those muscles on the outside of your hip are weak, they just can't stabilize your thigh bone properly. This lets the thigh bone rotate inward, which throws the whole alignment of your knee joint out of whack and yanks that kneecap right out of its happy place. And then let's look at suspect number 2, your feet. If your foot pronates too much, meaning it collapses inward when you walk, it sets off this crazy chain reaction up your leg. That inward collapse makes your lower leg rotate in, which then makes your thigh bone rotate in, and what's the end result? You guessed it, a misaligned knee that's taking on way, way too much stress. So if the problem involves the hips, and it involves the feet, if the whole chain is a bit of a mess, how in the world do you actually fix it? I mean, you can see why a knee-only solution is pretty much doomed from the start. We need a fix for the whole system. And that brings us to the modern evidence-based way to treat this. It's not about isolating the knee anymore. It's about integrating the entire kinetic chain into the solution. The research really points to a 3-pronged attack. First and foremost, the absolute gold standard is exercise therapy. Then we look at correcting the foundation with things like foot orthosis. And finally, some newer technologies like shockwave therapy can be used to help speed up the healing process. And let's be super clear about the exercise part. The research is unambiguous here. The programs that work the best are the ones that strengthen both the hips and the knees, not just knee exercises on their own. You have to fix that weak link up the chain to make the knee stable down below. And you know what? The exact same idea applies to our second suspect, the feet. Orthotics can be amazing for helping to control that excessive foot pronation we talked about. But, and this quote nails it, they work best when you pair them with exercise. They're not a standalone crutch. They're a tool to improve your mechanics while you're building up your strength. It's all about synergy. And finally, we've got shockwave therapy. The easiest way to think about this is like a biological kickstart. It sends a mechanical signal to your tissues that promotes healing and dials down inflammation. And honestly, sometimes that's the breakthrough you need to be able to do the crucial strengthening exercises without so much pain. So, what's the big picture here? What's the major takeaway? It's really all about completely reframing how we think about this kind of knee pain. If you remember just one thing from this whole explainer, let it be this. The site of your pain isn't always the source of your problem. Your knee might be the one screaming for attention, but a lot of the time, it's just the messenger, reporting a problem that actually started somewhere else, maybe in your weak hips or your unstable feet. Your body is this incredible, interconnected system. Just chasing the pain by treating the one spot that hurts, well, it's like trying to fix a leaky roof by only mopping the floor. You're missing the real issue. The real solution is looking at the whole structure. So the final question for you is, are you ready to listen to the whole story your body is trying to tell you?